Happy evening. Welcome to EduSkills OET Made Easy. Our mission is to make you fall in love with OET. This is a free platform. All the training programs of EduSkills International is free of cost, no payments. And if you're watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work, and please share the video to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. And today we are going to deal with Reading Part A. And I will be introducing a different method for cracking Reading Part A. It's not only this method or this approach is required for your Part B as well as Part C. So it's an analytical method. I have tried different methods. The previous method was viral. Almost everybody benefited from it. Still, some feel a bit of difficulty, or some are not able to cross 16 or 17. For such people, the last two scores you will crack. You'll see that you get 20. This is simply, I start straight away from here, like identify 4 text headings, and there are 4 texts I need not explain to you. So in that sense, I am not giving you the introductory part of Part A. 4 headings, 4 texts will have 4 headings. So your first business as you take Part A during your practice is to write down those on a piece of paper or on your notebook. Here you have contraindications and interactions, procedure, treatment, assessment. Okay. Second one, understand the relationship and the sequence among the 4 texts. 4 texts are in a sequence. There is a sequence for it. Normally, there are many sequences. For example, instead of contraindications and interactions, it can be something called description or definition, diagnosis, medication, management. In some texts, instead of treatment, they will say medication. Otherwise, it can be management, whatever. But there is a relationship between, there is a sequence, relationship between these 4 texts. And skim the 4 texts and highlight the clues. The first business is to skim, means jump, just go over, skim the 4 texts, highlight the clues means you have to highlight these clues. You have to underline or highlight the title, the section headings, the subheadings, the names, the number or percentage, sequential expressions, time expressions, scale, adjectives, and negative expressions. The major ones I have highlighted here. These are the things, as you skim through, you have to look for the title, Paracetamol Overdose, then section headings. As I said, 4 texts have 4 headings, subheadings, those things you have to identify. Then subheadings. Under text A, there are subheadings. Under every text, there will be subheadings. You underline those things. Then if there are some names of the medicine, or some organ, or some instrument, or some test, or some therapy, some virus, some medication, identify the names, then number or percentage. Identify or highlight the number or percentage. Then go into the sequential expressions. Sequential expressions, then time expressions. Then scale, adjectives, negative expressions. That doesn't mean things like modal verbs and all these things will be there, but for your skimming purpose, these will be the major things that you have to look into. I have taken a very familiar text because we need a familiar text to do the analysis. Otherwise, you may not understand the meaning and the connotations. Text A. This is text A. As we read through, just try to, if you have a text in your hand, as the system reads, try to underline and identify these clues, okay? What you have to do, I have given the clues on the side. You can see the side headings, right? On the right side, underline those things. For example, title is Paracetamol Overdose. Section heading is Paracetamol Contraindications and Interactions. Subheading is Special Warnings and Precautions for Use. Again, you have down interaction with other medical products and other forms of interaction. Listen.
Paracetamol contraindications and interactions 4.4 Special warnings and precautions for use. Where analgesics are used long-term, 3 months, with administration every 2 days or more frequently, headache may develop or increase. Headache induced by overuse of analgesics, more medication overuse headache, should not be treated by a dose increase. In such cases, the use of analgesics should be discontinued in consultation with the doctor. Care is advised in the administration of paracetamol to patients with alcohol dependency, severe renal or severe hepatic impairment. Other contraindications are shock and acute intimation of liver due to hepatitis C virus. The hazards of overdose are greater in those with non-cirrhotic alcoholic liver disease. 4.5 Interaction with other medicinal products and other forms of interaction. Anticoagulants. The effect of warfarin and other coumarins may be enhanced by prolonged regular use of paracetamol with increased risk of bleeding. Occasional doses have no significant effect. Metoclopramide may increase speed of absorption of paracetamol. Domperidone may increase speed of absorption of paracetamol. Cholestyramine may reduce absorption if given within 1 hour of paracetamol. Imatinib. Restriction or avoidance of concomitant regular paracetamol use should be taken with imatinib. A total of 169 drugs, 1,042 brand and generic names, are known to interact with paracetamol. 14 major drug interactions, for example amylnitrite, 62 moderate drug interactions. 93 minor drug interactions. A total of 118 brand names are known to have paracetamol in their formulation, for example Lemsip.
Unmute and tell me what did you find. I will highlight. Heading, you know.
There is title, paracetamol.
Title, Paracetamol Overdose, yes. Then
Section heading. There is subheadings.
this is section. Paracetamol contradictions and interactions is section headings, okay? Second one.
Bullet points.
And this one?
Special warning
That is
subheading.
names. Long
This
term.
is subheading. These two are subheadings. Now,
Okay.
do you have something here?
Scale,
What is
long
this?
term.
Long-term
What is
model.
this?
It's a scale.
Yeah, long term, it can be scale and it can be time expression. Time expression, 3 months. What I am saying, that should be the answer. So here it's very important in part A, what is given inside the brackets are important if there are numbers or names. Okay. Then as you go on, you have name of your name of your condition, disease. Headache is there. Then you have
Name of the
abbreviation.
Model is there.
Headache is there. Again, repeated. So what I am telling, these must be the answers.
Number of drugs.
Numbers.
Number of drugs. Okay, here numbers here are there. There are a couple of numbers here, many numbers. 169.
Scales also, Dr.
So
Father.
one of these must be the answer. There are many numbers, all need not be the answer, but one of these must be the answer, which will be understood from the question statement. Which one of these? Then what else you have? You have names of
Expression.
Medication name is there. Medications.
Medicines.
yeah. Here you see the interaction with other medical products. So medical products are important. Other medical products. Yeah. So here you have medical products. 1, 2.
Warfarin.
Yeah. All these all these are medical products. One of these will be the answer. All need not be the answer. One of these will be the answer. And you can see modal verb accompanying it, may. And here you can see may increase.
Yeah.
May increase, may decrease. When there are such expressions, one of those, you should be very careful. See, may increase and may reduce, there are opposites. So the question will indicate one of these. I'll highlight only 2 here as of now. Okay, all these are there, many increase and decrease. Okay, so let's check. Yes, now we have done with this one, skimming the text. And now we have to see title, section headings and subheadings we have already seen. There is nothing that we have to identify, already we have explained. I am showing it so that it fixes into your mind. Now you see here title, right? Here section heading. Then you have subheading. Then you have again subheading. These are very important. Answers are connected with that. You know, first number says ask for number of products. So answer should be number. Now question number 5 says there are 4 questions from this text A out of 20. Number 5 says the number of products containing paracetamol. So answer should be number. Yeah. So you have to look only for number. Nothing else can be the answer. Say question number 8, if paracetamol is used as a long-term painkiller, you have the time expression. What symptom may get worse? So time expression leads to the answer. Yeah, a symptom, definitely a symptom is going to be the answer, right? So
Yes,
you have to
brother.
look for symptom. And ninth one, it may be dangerous to administer paracetamol to a patient with which viral condition. So which viral condition? Something about viral condition. Name of a viral condition will be the answer.
Yes.
So you have to look for only viral condition. Here again, you have this name of the medication. So if a patient has taken metoclopramide alongside paracetamol, this may affect dash the of paracetamol. I said there is increase and reduce, increase and reduce. So definitely it will be connected with that. And as you have identified the names of the products, medical products, names of the medicines. One of them, I said, already it is identified here. This name is here, right? In the text. Just go there and find an answer. Okay. 4A, read the paragraphs and identify the clues. Okay, now we have seen into the heading, title, section heading, and subheadings. Now, these are the clues from the paragraphs. Already we have seen it. Sorry. Long term, 3 months. And symptom. Okay, you see, MOH is their abbreviation. Headache is there. Headache again, it is here. Headache is here. Repeated, which is not highlighted. So, long term, the sequence time expression is a clue. Then you have interaction with other medicinal products. And you have these medicinal products names, then the numbers. One of these names will be connected to the answer. One of these numbers will be connected to the answer. I'm just trying to convince you how the clues work. Now you see here, time expression, 3 months. Okay. Again, long term is the sequential expression. MOH is, okay, names or abbreviations. I used to say names or abbreviations. Automatically, they are equivalent to names. And you have other sequential expression, the other contraindications are shock and acute inflammation of liver due to hepatitis C virus. As we said, one virus condition related to virus should be the answer. So other, what is other? The sequential expression tells you here is the answer. And see name of a condition or virus, viral condition, name of a medical product, medication. And you see number. These are the answers. So you have the clues here, title, section, subhead section, name, number, sequential expression, time expressions. Okay, then you have all these may, all those modal verbs as an assistant. Again, check abbreviation, time expression. You have scale here, which I have not mentioned, but still scale and modal verbs are always there to assist you. And the symptom, headache, and name of a virus, condition, a viral condition, hepatitis C. And other modal verbs are there. May, should, year may. And you have name of a medicine, number. Then you have sequential expression, the other. Read the question statements, highlight the hedging words. Read the question statements. What is the hedging word? Number. Number of products is the phrase. Number is the hedging word. Now, what is the hedging word? Long-term painkiller. And also, what symptom? Time expression. Those leading to clues. What symptom is going to be the answer? Dangerous, viral condition. Dangerous and viral condition, name. Again, asking for a name of a condition. And now you have again here name of a medicine. Got it? So you have to identify, maybe if you find difficult challenging, or if you are not getting more than 15 score, definitely try this method. You'll get 20 out of 20. And there was a comment in the YouTube comment space. Is it possible that we can do all these things within 15 minutes during the exam? No, you are not going to do all these things during exam. You need not do anything during exam, because just as you glance through, you will find the answers. If you practice systematically, strategically, as I teach you now, you can complete the exam within 7 minutes, definitely. Compare the question statements with the answer statements in the text. Next step is compare the question statements with the answer statements in the text. Okay, now these are the question statements. You have answers here highlighted, clues highlighted. You have to compare them. You see here, number of products. So, you have one of the numbers will be the answer. But when you read the whole thing, containing paracetamol, known to have paracetamol in their formulation. See the synonymous language used. Containing paracetamol, have paracetamol in their formulation. Now you have, if paracetamol is used as a long-term painkiller, what symptom may get worse? Okay, you have here, right? Long-term, 3 months. Headache may develop or increase. Instead of worse, they have said develop or increase. It may be dangerous to administer paracetamol to a patient with which viral condition. One viral condition you have, is the answer. You have only about one virus here, hepatitis C virus. Okay, and the other one is the name of the medicine here. If a patient has taken metoclopramide alongside paracetamol, this may affect dash of the paracetamol. You see, you have to immediately go look for the name of that medication, not other details. Then, may increase speed of absorption of paracetamol. Of paracetamol is here, so what you have to write? Speed of absorption. As simple as that. That's why I want to just highlight these things. Go step by step. Take time. Maybe one day, if you are a beginner, take only text TE. Analyze with all these steps. See, again, I have highlighted the question statements and the answer statements. See, question number 8, if paracetamol is used as a long-term painkiller, what symptom may get worse? Analgesics are used long-term, more than 3 months, with administration every 2 days or more frequently. Headache may develop. Okay, develop or increase. Here, get worse. Again, it may be dangerous to administer paracetamol to a patient with which viral condition? You have here, other contraindications are shock and acute inflammation of liver due to hepatitis C virus. Again, you have the speed of absorption here, 14th question. The patient has taken metoclopramide alongside paracetamol. This may affect the speed of absorption of the paracetamol. Alongside paracetamol, the subheading says interaction with other medical products along with paracetamol. Means paracetamol with other medical products. The number of products containing paracetamol. A total of 118 brand names are known to have paracetamol in their formulation. Number of products containing paracetamol have paracetamol in their formulation. That's what we call synonymous language. See now here, paracetamol interactions, warnings and precautions. Those are the section heading and subheading. The number of products containing paracetamol. Number. You have the number. Then, if paracetamol is used as a long-time painkiller, what symptom may get worse? You have here analgesics. Paracetamol is included in that, right? So, inclusive words you should be able to understand. Again, see this question and other contraindications. The sequential expression is there. So, definitely, it's an indication there is an answer. Interaction with other medical products and other forms of interaction. See, interaction is important here. So it says alongside paracetamol means interaction. So may is the modal verb, increase speed of absorption. See the synonymous expressions. Paracetamol, long-term painkiller. Analgesics are used long-term, more than 3 months. Paracetamol is a long-term painkiller in the question statement. The text says analgesics are used long-term or more than 3 months. This is synonymous language. What symptom may get worse? Text says headache may develop or increase. Should not be treated by dose increase. That tells you these are the warnings and precautions. Subheading says whatever is given below are the warnings or precautions. So should not be treated by dose increase. It may be dangerous. It is a precaution or a warning. Other contraindications. Beware of other contraindications. Again, warning. Same thing I want to highlight. Again, you see how the questions headache may develop or increase. Symptom may get worse. Okay, headache may develop or increase. See here, interaction with other medical products. You have alongside paracetamol. Metoclopramide alongside paracetamol means paracetamol interacting with other medications. Medication names are given and one of them definitely is the answer. So just concentrate on those names of the medications. Then the next one is the number. Question says number of here, total of. Text says total of. Worse, increase or develop. Dangerous, contraindications. These are synonymous expressions. Hope you got an idea.
Yes, Father.
Good, sir.
Yes. Yeah. I have taken only one. I want to teach you patience. Do you want to visit any of the slides?
Yes, sir. Sure.
Since there were many who in the waiting room, many could not get in. We will be conducting next
Thank
session,
you for that.
repeat session in Malayalam. Yes,
The,
so we have Malayalam text here. And look at model
the
verbs.
next, the second one, the understand the relationship. That A B C D, C A D B.
You mean this one? This one?
Yeah.
Yeah. Here, contraindications. After that, you have procedure given, then the treatment, then the assessment. See, you cannot do the assessment before treatment, right?
Yeah. Okay.
Procedure should be before treatment, right?
Yeah, yeah.
So there is a connection sequence between these headings. For example, some other text it will be first they will give the condition definition or description of the condition and classifications. Then they will give you diagnosis or clinical investigations. Then they give medication, which is equivalent to treatment. Then they may give assessment or management. So there is a relationship between all these four texts that you have to understand. So when you look at the questions, you know whether they are speaking about the diagnosis or about the medication or about the management. See, if you are speaking about diabetes and the question speaks about exercise or diet or tablets or insulin, you know they are speaking about medication or management. If it is about exercise and diet, it will be about management. If it is about tablet and insulin, it will be about medication or treatment. So just looking at the questions, immediately, you know, this comes from this text. The answer must be in this particular text. So the questions 1 to 7, easily you can identify and write down.
Thank you, Father.
Welcome. Any other clarifications?
Excuse me, Acha, Tony here.
Yeah, please, Tony.
Acha, I have a little confusion about question number 8. They ask for a viral condition. So the viral condition should be hepatitis C or hepatitis C virus or inflammation of the liver. Which one?
It should, because it's answer you should never write. It's asking which virus condition. Never write virus. Don't include the word virus. That will be repeated. So hepatitis C is the answer.
Okay, just write hepatitis
C. If you write virus, you will lose the mark. I'll just take you there. One sec. See here, the question is, it may be dangerous to administer paracetamol to a patient with which viral condition? Hepatitis C. Because shock and acute inflammation of liver due to which virus? Hepatitis C virus. Now the question is, it may be dangerous to administer paracetamol to a patient with which viral condition? With the hepatitis C condition. Don't write virus there. It will be wrong. I think I highlighted it somewhere. I have highlighted here. See, I have highlighted virus in red. It may be dangerous to administer paracetamol to a patient with which viral condition? Hepatitis C. And I have highlighted red because it should not be written in the answer. Which condition they are asking? So the answer should be hepatitis C. Which viral condition? Viral is already there.
Thank you, Acha.
So also, for example, if they are asking about a particular blood test, and test is there in the fill in the blanks in the question statement. Never write test again. Tell me one abbreviation with the test.
Liver function test.
Liver function test. So liver function, if the test is given in the question statement, never write liver function test. You have to write only liver function as the answer, because test is there already in the question statement. Fill in the blanks. Okay. Don't repeat that. If you write liver function test, that will be wrong answer, because test is already given in the question statement. When it is filling the blanks, when you read with your answer, the sense should be there. Otherwise, it will become liver function test. That's absurd, right?
Sure, sir. It makes sense, sir.
Yeah. Quite often people make such mistakes, especially when they are tensed in the exam, during the exam.
Father, thank you very much for such a nice clarification. When I'm going to start my part
Reading
A,
text to 2 minutes only, da.
Yeah, reading text.
She's asking that text, how many minutes to take?
Text. Now, if you practice strategically this way, you don't require time at all. There, you can go with the seconds. We don't count. If you can see that one particular video, first video, part A, first video, which has got more than 1 lakh views now. There, I am giving you live, even it is not edited. A lot of distractions are there, because I wanted to make you realize. First time I am showing the participants, the aspirants who are in the Zoom classroom, 4 texts, 5 seconds each. It's live there, you can see. 5 seconds each. One text, 5 seconds to read. They are seeing that text for the first time. And within 20 seconds, they have completed skimming, glancing over the text, And within 1 hour, 1 minute, 56 seconds, they have answered first 7 questions. 1 hour, 56 seconds, because I was asking them, so there was interruption. Otherwise, they can complete it within 1 minute maximum. 7 questions in 1 minute. So you don't require typical time. Maybe in the beginning, you require a lot of time. That's what I said. Take text A, do it 1 day. Analyze, understand these connections as I have done here. Understand the connections, compare, contrast. That's the way you practice, start learning. Then it becomes very easy for you. Your mind will be set on that. So what I'm telling you, we can't tell you exactly how much time you require. Maybe a couple of seconds. Then maybe you complete out of 20, you got 15 answers without taking much time, just by skimming. Then you are left with 5. Maybe you have a lot of time. You can go deep into the paragraph and scan it. Typically find specific answers. Okay, you will have a lot of time for that. There are many people who have completed in 7 or 8 minutes a part and got out 20 out of 20.
Thank you, Father. Thank you very much, Father.
Yes,
This is really clarifying and helpful.
Yes. And if you see my previous video, I have told you exactly first time you have to match the question with the paragraph. That is one of the steps. Don't try to answer. Try to just identify in which paragraph, not 1 to 7. Actually, in exam, you have 1 to 7 questions in this regard, but you have to match all the 20 questions with the text, A, B, C, or D. That gives you real competency to locate.
Okay, Father. Thank you so much.
Yeah. Good luck. Don't worry, Gaimai. We give you a concession. If you have a confusion, you take only 470, 30 concession.
Sure,
Out of 500, you can take only 470. You'll be happy.
Okay,
Yes.
Father. Thank you so much.
Cool, ma. Cool. God bless you, ma.
Hello, Father.
Happy to. Yes, please.
I am from KMC Manipur. Sir, really helpful for us, sir. It would be greatly appreciated.
Yes, definitely. It's all done by health professionals. I am just assisting them. This platform is run by health professionals. Thousands of them are learning here, and we provide everything free. We try to give them maximum. We have uploaded almost everything regarding OET. Videos are uploaded. And you have the application where it will take you step-by-step. Application means once you complete the task, it will take you to the next step. So step-by-step, it will guide you. Yes.
I like your mission, sir. Really, I like your mission.
Thank you.
Support, okay, grow together, empower, grow together, help
empower each other and grow together. Empower each other and grow together. As you go with the task, we will assess you with the self-assessment form that you fill in every week and submit. And as per the requirement, we are giving you the class. Now we are repeating part A because some of them are able to score only 17 or 16. They are not able to cross and go to 20. So this session is specifically meant for those people who get 17 or 18 are not able to reach 20. So I have given you different strategy how you can even get into finer competency. The other community group posting will start from tomorrow, right?
Okay. In that group,
yeah, for Monday, writing begins on Monday, right, Sunita?
Yes, Father. We are planning to post it from Monday onwards.
Things will begin from Monday onwards, the writing. Yes.
Father,
please.
Father.
Only one father here, one at a time, please.
Father, I would like to ask something. Yes. We don't need to repeat the word for any question in that part A.
If it is fill in the blanks and the word is given in the question statement, never ever repeat. If you repeat, you won't get the score.
Standing 4 minutes, I'm taking, Father. Unknowingly, I'm taking, Father.
That's okay. In the beginning, it's okay. But that's why I said, now this is particularly for you. Since you are taking unknowing time, you try this method, circle, underline, and highlight, and scribble your whole paper. There should not be any point of place where you can put a needle. So then what happens next time, automatically this will blink. These clues will blink at you. You just go through only those things. Numbers will blink. Names will blink. The heading will tell you this is speaking about interactions with other medical products, or these are the precautions or warnings. So the questions will be about the warnings, dangerous things, what should not be done. Got it? Okay. So don't worry about your time. As you go on practicing, you will be killing the time. If you are taking 4 minutes now, after some time you will take 2 minutes, then 1 minute. Maybe then I said 20 seconds to skim. 20 seconds. Live video is there. You can see with all the distractions. I have not edited that video. The first video about Part A session, which we have taken during Corona. Only 20 seconds. Then the first 1 to 7 answers were given in 1 minute 56 seconds. Yeah.
Good evening, sir.
Yeah, good evening. With good evening, you should have a smile. Okay, that's the signature of the platform. Yes. Okay.
Kausar from Pakistan, sir.
Yeah, most welcome. Most welcome. Happy to have you here.
Thank you so much, sir. Actually, I would like to really, I'm very thankful to you for your platform. And since I have seen your video, I don't know, accidentally I got your channel. But I'm really blessed by your channel, and now I can see the improvement in my reading, and I already had your assessment form also.
Thank you so much.
Thank you, Father. Thank you, Father.
Thank you, Father.
Welcome. Bye-bye. Yes, welcome.
Thank you, Father.
Thank you
Yes.
so much, Father.
God bless you. Bye.